So today we'll talk about electroshock therapy. Well, in the movies, we often see when the patient is on the ER and he's like flatlined, and then the doctor comes running in and he gets two pads and put him on the chest and shouts clear, and then the person he gives a shock and the person start breathing in, all of that. Well, that's basically nothing of that is true. So normally it's not an emergency. In emergency, almost it's never an emergency. You can even book a electroshock therapy, and the person is conscious until a few seconds before the shock. They sedate the person because, as you can imagine, it hurts a lot being shocked. And we have shockable um, rhythms. There are ones that you cannot shock. The ones you can is AFib, VFib, VTAC. And so that thing, those pads are called the defibrillator. You have synchronized electrical cardioversion and or asynchronized cardioversion, which is in the R segment. AFib and atrial flutter and atrioventricular nodal reentrant tachycardia. We studied about all of these things, and VTAC with the pulse. And at any time, we can do it with ventricular fibrillation, VFib, VTAC. And if you have higher energy levels, you put higher energy levels on this in this part here. VTAC, if the person is stable, you may treat differently as if there is no pulse, or with pulse if it's unstable or stable. And other thing is the pacemaker. So it has the pulse generator, a battery, a control center, which is kind of like a computer, and the electrodes that go into the heart. If you have bradycardia or tachycardia, bradycardia, low heart rate, tachycardia, high rate heart rate. We have a few types. We have the external intracutaneous, which is for emergency. The transcutaneous. I have a temporary, which is during surgery, or if you have an inflammation causing a bradycardia. We have the temporary, which is transvenous. That means it goes through a vein, like the vena cava, for example. And that it's mainly for temporary abnormalities, or if waiting for a permanent one, which is this. Now it goes inside the body, and it blocks the pulses that come from the brain. It makes its own pulses.